Hello, coders. Hello, everybody. Happy Monday. Can everybody hear me? Let me know in the chat if you guys can hear me, and I will go ahead and get started. All right, I'm getting a yes. Thank you. Thank you. All right. Well, welcome everyone. Hello and welcome coders to our week 1 ICD-10-CM Guideline Mastery session by AMCI. My name is Miss Haley and I will be your lead instructor for tonight. And I am so excited to be a part of this class. I believe that mastering the guidelines in the ICD-10-CM book is a great way to set a solid foundation for real-life coding scenarios. So with this, please keep in mind that this does say 2026. So we are going to be using the updated 2026 ICD-CM guidelines. So if you're using the 2025 book, they may be organized a little differently, but you will still be able to follow along just fine. All right. And to start off this class, I would like to introduce you to some of the other wonderful instructors that make up our awesome AMCI team. If you have attended other classes or watched some of the other videos, I'm sure you recognize some of these people. So first we have me, Miss Haley, and then we have Mr. Sandeep, followed by Miss Dolly, who is going to be in the chat helping out as well. And we have Mrs. J, and we have our Miss Mills as well that is going to be in here. Hello, everybody. All right. And we also have our wonderful Miss Olga. This is our AMCI intern team. So Miss Olga will also be in the chat with you guys tonight to cheer you guys on, offer assistance, and answer any questions that you may have. We are also super excited to have her be a part of this Monday night team. So welcome, welcome. All right. And before we get to the fun stuff, I'm going to go ahead and read our copyright. So CPT, AMCI, copyright 2026, American Medical Association, all rights reserved, fee schedules, relative value units, conversion factors, and or related components are not assigned by AMA, are not part of CPT ICD-10-CM, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. CPC ICD-10 is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, Chun, AMCI Fab 7, AMCI ICD-10, Flip, TAP, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI does not own the right to these credentials. All right. So now that we got that out of the way, without further ado, we will begin our week 1 topic, which is going to be Human Immunodeficiency Virus, or as I'm going to refer to it a lot as just HIV guidelines. All right. Here we are. So before we get into the HIV guidelines, let's do a refresher of what human immunodeficiency virus actually is. So human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system. specifically CD4 T cells, which are essentially for fighting infections. Over time, if untreated, HIV weakens the immune system and can progress to acquired immunodeficiency syndrome, or also known as AIDS, the most advanced stage of the infection. So HIV is transmitted through contact with certain body fluids, such as blood, semen, vaginal fluids, rectal fluids, and breast milk. This is most commonly through unprotected sex, sharing needles, or from mother to child during childbirth or breastfeeding. There is no cure for HIV, but it is manageable. Antiretroviral therapy, ART, allows people with HIV to live long, healthy lives and can reduce the virus to undetectable levels, preventing transmission to others. And then this is just going to be an example of what an HIV cell kind of looks like, just to get an up close look. All right, and we are going to start with our first guideline. So this is going to be one of the most important ones. This is going to be code-only confirmed cases. So code-only confirmed cases of HIV infection or illness. This is an exception to the hospital inpatient guidelines, section 2H. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. And as we like to always say, if the patient was ever B20, then they are always going to be B20, which is the code for the HIV. B20 is going to be the code for HIV, so the code does not go away or expire. If the patient was diagnosed with HIV, they will always have that code. All right, moving on to our next guideline, HIV disease. In terms of AIDS or HIV disease is documented, or if the patient is treated for any HIV-related illness or is described as having any conditions resulting from the patient's HIV positive status, which is going to be the code B20, the Human Immunodeficiency Virus, HIV, should be assigned. So this is going to be a coding example of what that would look like. So the example is a patient with a known HIV infection is hospitalized for chronic diarrhea and significant weight loss. The symptoms are attributed to the patient's HIV disease, and antiretroviral therapy is continued during the stay. So with that being said, this is kind of a piggyback on what was previously mentioned about the B20 codes. So you would use the B20 code for this instance, which is going to be that HIV code. And that would be the code used because the patient has a confirmed HIV infection and current symptoms are due to the HIV disease. All right, and then moving on to our next guideline for our ICD-10-CM. So patient admitted for an HIV-related condition. So if a patient is admitted for an HIV-related condition, the principal diagnosis should be B20, that code for HIV disease, followed by additional diagnosis codes for all reported HIV-related conditions. An exception to this guideline is if the reason for admission is the hemolytic uremic syndrome associated with HIV disease, aside code D59.31, which is infection-associated hemolytic uremic syndrome, followed by code B20, the Human Immunodeficiency Virus disease. So we can ease that up with an example. So an example of this guideline would look something like a patient with a known HIV infection is admitted for treatment of Kaposi sarcoma. The patient is continued on antiretroviral therapy during the admission. So A little bit about Kaposi sarcoma. If you guys don't know, it is going to be a type of cancer that forms in the lining of blood vessels and lymph vessels. So this is often presenting with lesions on the skin or in other organs. And most importantly about this disease is that it commonly is associated with HIV and AIDS because it targets a weakened immune system. So with that being said, this would be considered an HIV-related illness. And this is why the sequencing looks the way that it does. So this is why our first and primary code is going to be the B20, which is the Human Immunodeficiency Virus. And then the second code is going to be that C46.9 for the Kaposi sarcoma. All right, is that making sense to you guys? Let me know in the chat. Are we following along? Are these examples helping? Let me know. And we are going to move on to our next guideline. All righty. Our next guideline is going to be patients with HIV disease admitted for unrelated conditions. So this is going to kind of be the opposite. Thank you for the responses in the chat, guys. This is going to kind of be the opposite of the guideline we were talking about just last. So if a patient with HIV disease is admitted for an unrelated condition, such as a traumatic injury, the code for the unrelated condition, like the nature of the injury code, should be the principal. Code B20 would be reported as a secondary diagnosis. Codes for other documented conditions should also be reported as secondary diagnosis. So an example of this would look something like a patient with HIV disease is admitted after a bicycle accident, resulting in a closed fracture of the left tibia. The patient has no HIV-related complications. So with this, the reason for the encounter, or the RFE, would be the fracture of the left tibia. And that is why it's going to be the first code. So the S82.202A, which is the unspecified fracture of shaft of left tibia, initial encounter, that's going to be the primary code. And because this individual has HIV disease, that is going to be the second code, which is going to be that B20 code. All right. Amazing, amazing. All right, and then our next guideline is going to be patient with newly diagnosed HIV disease. So whether a patient is newly diagnosed or has had a previous admission or encounters for HIV condition, that is irrelevant to the sequencing decision. So this is saying that it does not matter if you are recently diagnosed with HIV or you've had it for a longer period of time, you still are going to follow the same sequencing rules as we were previously discussing. So keeping that in mind, here are a few examples using this guideline. So our first one is going to be a patient is newly diagnosed with HIV during a hospital admission for a fractured arm after a fall. So our first principal diagnosis is going to be S42.90XA, and this is the code for the unspecified fracture of the upper arm, initial encounter. And then our secondary diagnosis is going to be our B20 code. So that is because when the patient came in, although they were newly diagnosed with HIV, the reason that they came in was not because of the HIV, it was because of the fractured arm. So that is why we are going to be having the principal diagnosis code as the fracture of the arm. All right, and then our second example is going to be a patient with a history of HIV is admitted for appendicitis. So this is going to kind of be similar to the last example. The principal diagnosis is going to be K35.30. This is going to be the code for the acute appendicitis without perforation or abscess. And then, oh no. Thank you. So sorry, I didn't realize it was blocking it. Okay, so now that we can see that, our secondary diagnosis is going to be that B20 code for the HIV. So this is going to kind of be similar to the previous example that we used. So you're still going to stick with the reason for the encounter is the appendicitis. So that's what's going to be coded first. And then our third is going to be a patient with known HIV is admitted with pneumocystic pneumonia. So again, this is a little bit of a trickier one. So pneumocystic pneumonia is an HIV-related illness. So it is an opportunistic infection caused by a fungus. It primarily affects, again, individuals with a weakened immune system. So with that in mind, our principal diagnosis will be the B20 for the HIV disease. And then the secondary code is going to be the pneumonia in HIV disease. So this is why we're using the B20 code first. So I know a lot of people aren't going to know all of these diseases right off the bat, if they're HIV related or not. So I definitely would recommend looking up these illnesses and seeing if they're related to HIV before determining your sequence. That would definitely be helpful in the sequencing, because if it's HIV related, then your principal diagnosis changes. All right, how are we doing so far? Are we doing okay? Yes. So it would be flipped. Yes. So that's using our previous guideline of the HIV related illness. Does that make sense? Are we still doing okay? Let me know in the chat if you guys are still doing good. All right. And while you guys are typing in there, we're going to move on to our next guideline. So our next guideline is going to be asymptomatic human immunodeficiency virus. So this is going to be different than the B20. So when HIV positive, HIV test positive, or similar terminology is documented and there is no documentation of symptoms or HIV-related illness, you're going to use code Z21, which is going to be asymptomatic human immunodeficiency virus. So asymptomatic HIV infection status, and that should be assigned for that. So an example of this, let's look right here, is going to look something like this. So a patient is known to be HIV positive, but has no symptoms or HIV-related conditions. The patient is admitted for a sprained ankle. So, of course, they're coming in, the RFE, or the reason for encounter, is going to be that sprained ankle. So the principal diagnosis is going to be S93.401A. So that's going to be the sprained of unspecific ligament of left ankle initial encounter. And then the secondary diagnosis, instead of it being the B20 like we've seen, it's going to be Z21, the asymptomatic HIV infection status. And that is going to be because there are no documentations of symptoms or HIV-related illnesses. Some keywords for this are definitely the no symptoms, but HIV positive. If the patient has no symptoms of HIV and tests negative for HIV, then you simply don't need to use the HIV code because it is not a confirmed case. All right. Moving right along, we have, speaking of tests, we have an inconclusive HIV test. So what if someone has an inconclusive HIV serology test? So patients with documentation of inconclusive HIV serology may be assigned code R75. So this is inconclusive laboratory evidence of human immunodeficiency virus. So an example would look something like this. So a patient has an intermediate HIV antibody test during a routine physical. No symptoms of HIV are documented and no diagnosis of HIV is made. So this is when we're going to use that R75, which is going to be the inconclusive lab evidence of HIV. So the key word is indeterminate. So this code is only used if the results are inconclusive. So not if they're negative, not if they're positive, specifically if it's inconclusive. So definitely look out for the wording when you're looking at situations like this and be able to look at the keywords so you can plug in what guideline to use. All right. Next up, we have previously diagnosed HIV-related illness. So this is patients with documentation of a prior diagnosis of an HIV-related illness should be coded to B20. Once an HIV-related illness has developed, code B20 should always be assigned on every subsequent admission or encounter. So patients previously diagnosed with any HIV illness, B20, should never be assigned R75, inconclusive lab evidence of HIV, or Z21, asymptomatic HIV virus. So like we were saying before, once you have received the code B20, you will always have the code B20. The B20 is never going to switch over to Z21. The code's never going to switch up to an inconclusive test. If you are B20, that code stays with you. So an example of this is going to look like a patient was previously diagnosed with an HIV-related illness. The patient is now seen in the clinic for high blood pressure. The provider documents history of HIV disease and no current HIV symptoms. So the primary diagnosis is going to be I-10, which is going to be the primary hypertension, which is what the patient came in to get treated in the first place. And then your second code is going to be the B20, code. So the high blood pressure is the reason coming in, but you're using B20 instead of Z21 because they don't have symptoms now, but they were previously diagnosed with an HIV-related illness. So definitely keep in mind, again, I know I said it 500 times, but if the patient was ever B20, they will always be B20. Alrighty, moving right along to our next guideline. All right, so this is going to be guidelines related to HIV during pregnancy. So this guideline is HIV infections in pregnancy, childbirth, and the puerperium. So when a patient presents during pregnancy, childbirth, or the puerperium with documented symptomatic HIV disease or an HIV-related illness, assign a code from subcategory 098.7, which is human immunodeficiency disease complicating pregnancy, childbirth, or the puerperium, followed by code B20 and any additional codes for HIV-related illnesses. Codes from Chapter 15 always take sequence priority, and that's very important to keep in mind. Codes from Chapter 15, so those O codes, are always going to take sequencing priority. So when a patient presents during pregnancy, childbirth, or the puerperium with documented asymptomatic HIV infection status or is HIV positive, assign the code from subcategory 098.7 followed by Z21. So whether they have an HIV-related illness and they're using B20, or if it's asymptomatic, you're still going to begin with that 098.7 code. So there's two examples that I have. So this is the one using B20. So a 32-week pregnant patient is admitted for treatment of an HIV-related pneumonia. So again, codes from Chapter 15 always take sequencing priority. So the principal diagnosis is going to be 098.73. This is going to be the HIV disease complicating pregnancy, and this is going to be the third trimester because she is 32 weeks pregnant. And then the secondary diagnosis is going to be that HIV disease because she has HIV-related pneumonia, so that's an HIV-related illness. So that's why we're going to be using the B20 code. And then we're also going to be using another code is the J17, which is the pneumonia in HIV disease. So these are secondary codes, but the principal diagnosis is always going to be an O code. All right. And then our second example is going to be a 7-week pregnant patient with asymptomatic HIV infection is seen for routine prenatal care. No HIV-related illnesses are documented. So again, the patient is pregnant. You always use the 098.7 code first, followed by the Z21 code since the patient is asymptomatic. It's probably not always going to be so cut and dry saying they're asymptomatic, no HIV-related illnesses, but those are definitely some keywords to look out for, and that is why we're having our Z21 code as our secondary diagnosis. Alrighty, got just a few more guidelines left, and then we can get some reviews so we can put all these guideline knowledge to the test. All right, moving on, we have encounters for HIV testing for HIV. All right, so this is going to be if a patient without signs or symptoms is tested for HIV, assign code Z11.4, which is encounter for screening for Human Immunodeficiency Virus, HIV. Use additional codes for any associated high-risk behavior if applicable. If a patient with signs or symptoms of HIV presents for HIV testing, code the signs and symptoms. An additional counseling code, Z71.7, HIV counseling may be assigned if counseling is provided during the encounter for the test. Code Z11.4, which is encounter for screening for HIV. This should not be assigned if HIV signs and symptoms are present. When a patient presents for follow-up regarding their HIV test results and the test results are negative, assign code Z71.7, HIV counseling. If the results are positive, see previous guidelines and assign codes as appropriate. So that was a big old long guideline. So to break it down and make it a little easier to understand, we have a few examples of what this guideline would look like coding in the real world. So our first example is going to be a patient is seen only to determine HIV status. The patient has no signs or symptoms. So again, the keyword, it's going to be no signs or symptoms. So this is when you would use the Z11.4 code, which is just the encounter for screening for HIV. So no test results yet. Nothing needs to be, no extra guidelines need to be tacked on. They're just going to determine the HIV status. This is when you would use that Z11 code. All right, our next example is MA patient presents with unexplained weight loss, night sweats, and is tested for HIV. So the patient is presenting with signs and symptoms, which are going to be the abnormal weight loss and the night sweats. So the Z11 code would not be used in this instant going off of the guideline. So we're going to code the signs and symptoms instead because that's what is labeled in here. We have the signs and symptoms, so we can use that instead of the Z11 code. So that is why we are coding the R63.4 and the R61, which is the abnormal weight loss and the generalized hyperhidrosis. So that's going to be the night sweats and the weight loss instead of the encounter for screening. All right. And then our next example is going to be a patient receives pre-HIV counseling during a visit. So we're going to be using both the Z11.4, the encounter for screening for HIV, and we're going to be using the Z71.7, which is going to be the HIV counseling because they're getting their test and then they're also receiving counseling in the same visit. So that's when you would include both of these codes. All right. All right, and moving right along. This is going to be our last guideline for the night before we can do some review and get into some questions. So this guideline is going to be encounter for HIV prophylaxis measures. So when a patient is seen for administration of pre-exposure prophylaxis medication for HIV, assign code Z29.81, which is going to be encounter for HIV pre-exposure prophylaxis. So pre-exposure prophylaxis, or PrEP, is intended to prevent infections in people who are at risk of getting HIV through sex or injection drug use. Any other risk factors for HIV should also be coded. So what does that look like in a real coding scenario? An example of this is a patient who is HIV negative is seen in the clinic to receive pre-exposure prophylaxis, that PrEP medication, to prevent HIV infection. The provider documents that the patient is at high risk due to injection drug use. So this is when we're going to have our principal diagnosis as the Z29.81, which is the encounter for HIV pre-exposure prophylaxis. And we're also going to include Z72.2, which is going to be the drug use, unspecified. So this is going to be an example of a risk factor. So when it says any risk factors for HIV should also be coded, the injection drug use is something that should be included in the coding, because sharing needles, that's a way that people get HIV. So that would definitely be a risk factor, and that should definitely be coded. All right. How are we feeling? I know that I threw a lot of information at you guys. So before we go on to some coding scenarios, I want to know, let me know in the chat, how are we feeling? Did the guideline explanations help? Are we feeling more confident? What are we thinking about these guidelines? And then we are going to move on to some, oh yes, I'm looking at the chat. Very nice, everybody. Thank you for all of the feedback. All right. Oh, yay. Glad people are feeling more confident. Thank you. Thank you. That's why we're here. That's why we're here. All right. So let's go on to our first scenario. And you guys put your answers in the chat and let me know what you think the answers are. So our first question of the night is going to be: a patient with documented HIV disease is admitted for a fractured femur. No HIV-related conditions are treated. Which of the following codes should be assigned as the principal diagnosis? So I'll give you guys like one or 2 minutes, and we will then we will go over what guidelines should be used with this and go over what the answer will be. Look at some keywords. I'll give you guys just a few seconds. All right. I'm getting a few answers. All right. Amazing job, guys. So yes, you guys would be correct. The diagnosis for this is going to be S72.90XA. All right. And then let's see. And so this is going to be the guideline that we're using. So the guideline that we're using to get to this answer is going to be: the patient with HIV disease admitted for an unrelated condition. So this patient came in for a fractured femur. So There's some good keywords in here. There are no HIV-related conditions or treated, so that's a really big key factor there. So the S72.90XA, that is going to be the code for the fractured femur. So if you got that, then you are off to an amazing start. Great job, guys, and great participation in the chat. All right. Let's move on to another one. Okay, so this one is going to be a patient is documented as HIV positive with no symptoms or HIV-related conditions. Of the following answers, which best describes this scenario? So is it going to be A, B20, B, R75, C, Z21, or D, Z11.4? I'll give you guys about 1 or 2 minutes and then we will go over it. All right. Amazing job, guys. We're getting some good answers in there. So the answer for this one is going to be Z21. So the guideline that we're using in this instance is going to be the asymptomatic HIV. So because the keywords for this are going to be no symptoms or HIV-related conditions, but they are documented as HIV positive. So those are like a keyword soup. I don't know why I just said that. A keyword soup, but it is kind of a keyword soup. And that makes for the Z21, the asymptomatic code. And that is what is going to be the best case, the best code to use in this scenario. All right, let's move on to another example. All righty. So next one, a patient with no prior HIV diagnosis presents for HIV screening due to beginning a new sexual relationship. So the test results are negative. Of the following answers, which code best describes this encounter? Is it going to be A, Z11.4, B, B20, C, Z21, or D, R65? I'll give you guys a few minutes. All right. These answers are just flying in. We can go ahead and move on. This is awesome. Thank you guys for all the participation. So everyone so far has got this one right. It is indeed going to be Z11.4. Amazing job, guys. So the guideline that we are using to help us answer this are going to be the guidelines for encounters for HIV testing for HIV. So again, the Z11.4 code is going to be the encounter for the screening. So the keywords that we're going to be looking for in this example is going to be no prior HIV diagnosis, looking for the HIV screening, and test results are negative. So those are all the keywords that you would be looking for to find this answer, which you guys did because everyone got this one right. So pat yourself on the back. Amazing job. You guys are killing these guideline questions. All right, let's move on to the next one. Okay. A pregnant patient is admitted for HIV-related candidiasis. Which of the following answers is correctly sequenced? So are we thinking A, B20 first, and then 098.7, B 098.7 first, and then B20 in the illness code, C Z21 first, then 098.7, or D R75 first, and then B20? What are we thinking as far as sequencing goes, guys? And we will go over the guideline in a few minutes once we get some answers in. All right. Amazing job. I was going to give a few more minutes, but again, these answers are just flying in. You guys really know your stuff. So, again, a pregnant patient admitted for HIV-related illness. Which are we thinking? All right. So, obviously, it is not obviously, but it is going to be B. Everyone got this one right. So, it is going to be 098.7 first, and then B20 in the illness code. Amazing job, guys. So we are going to be using the HIV infection in pregnancy, childbirth, and the puerperium. So that is going to be the guideline that we're going to be using. And I know I said it a million times, but it obviously is marinating with you guys. The code from chapter 15 is always going to take sequencing priority. That O code is always going to be used first. And great job determining whether you're using the B20 code or the Z code, because this is definitely an HIV related illness. So we are going to be using that B20 code, and then we're going to be using the illness code as well, which is going to be the candidiasis. And so you guys absolutely rocked this one as well. Amazing job, guys, and great participation. All right, we have a few more going on. So let's see what we have next. Alrighty. So a patient previously diagnosed with HIV-related Kaposi sarcoma is admitted for a non-HIV related condition. The provider documents no new HIV symptoms. Which ICD-10-CM code guideline applies? So is it A, assign R75 because the patient currently has no new HIV symptoms? B, assign Z21 since the patient is asymptomatic? C, assign the code B20 because any subsequent encounter for a patient with prior HIV-related illness always includes B20? Or D, assign Z11 for routine HIV screening? I know that was a lot, so I will give you guys a minute or two. I know you got this one. I know you do. We'll see you in a sec. All right, all right. I am seeing the chat. Nothing can trip you guys up. I thought I could be a little sneaky and get a little complicated with this one, but you guys are on top of it. So it is indeed going to be for this. So again, patient previously diagnosed with HIV-related Kaposi sarcoma, which we did discuss what that was earlier. It was affecting a weakened immune system. So, as it said, HIV-related, admitted for non-HIV-related condition. So, no new HIV symptoms. So, yes, we are going to be coding the B20 code because any subsequent encounter for a patient with prior related HIV illness always includes B20. So again, as you guys know, once B20, always B20. So we are going to be using the code for previously diagnosed HIV related illness because this patient was previously diagnosed with the HIV related sarcoma. So amazing job. You should definitely be coding the B20 and you guys are rocking it. Yes, gold star for you all indeed. Amazing job. All right. I'm not sure how many more we have left, but I think we have. Okay. All right. Next one. Which of the following codes should never be reported together? Is it going to be B20 and B59, Z21 and Z11.4, B20 and Z21, or Z20.6 and Z29.81? I will give you guys a few minutes. All right, all right. I'm getting a lot of amazing answer awesomeness. So, everyone, again, got this one right. Amazing job. So, yes, B20 and Z21 are two codes that should never be reported together. Extra points. Why? Why is that? Why should B20 and Z21 never be reported together? Put it in the chat. Why is that? Exactly, exactly. You can't have symptoms and asymptomatic at the same time. You guys rock. That is 100% correct. Yes, B20 is our HIV related illnesses, it's our symptoms, and Z21 is our HIV positive, but no signs or symptoms. You are correct. You guys are rocking it. All right. Let's move on to our next question. Yes, once diagnosed with B20, the testing exactly. Amazing, guys. Alrighty, we are going to move on to our next one. So, a 35-year-old patient presents after a high-risk exposure to HIV. I should have said that. After a high-risk exposure to HIV, the rapid HIV test comes back indeterminate, and the provider documents inconclusive HIV serology. The patient has no symptoms. Which of the following codes best describes this scenario? Are we thinking A, Z21, B, Z11.4, C, B20, or DR75? I know you guys are already flying away in the chat, but I will give you a minute or two. I will be back. Alrighty. Amazing, amazing response. I am getting in the chat, everybody. You guys did awesome with this one. You've been doing awesome with all of these, so great job. It is indeed going to be DR75. And of course, the guideline that we're going to be using is the Inconclusive HIV serology. So yes, so the keywords, obviously, inconclusive HIV serology. That's some pretty good keywords. And also exposure, indeterminate would be a good one. No symptoms. So whatever keywords you guys were picking out, it definitely paid off because you guys killed it with this one. All right. I'm not sure how many we have left, but I want to see we have another one. We do have another one. All right. All righty. So a 35-year-old patient presents. Oh, never mind. This is the same exact one. Oopsie. I pressed the wrong button. Okay. Then that was the last one. Oh my goodness. You guys absolutely killed it. I was going to leave more time on the clock, but my goodness, you guys, I'm going to have to come up with some more difficult questions for our next class on Monday. I really appreciate everybody that has taken the time out of their Monday to attend this class. I'm really excited to move on to more guidelines, and I hope that everyone left feeling more confident about their at least HIV ICD-10 guidelines. You guys definitely did amazing with those review questions. So you guys are doing great. Yes, it is recorded, and you will be able to view it, the live classes. So if you need to, look back on this video for any reason or get some extra practice in, you can totally do that. I really appreciate you guys signing in. So next week for week 2, we're going to be focusing on sepsis guidelines. So that's going to be, kind of the same flow for the class, but we're going to be focusing on a different guideline. So my wonderful team is going to post a feedback survey in the chat, whether you're on YouTube or you're on Discord. So definitely click that and let us know how we're doing so we can improve, so we can be the best possible learning that we can have for you guys. I appreciate all of the wonderful words, and I hope to see you guys next week. I hope everyone has an awesome rest of their Monday, and thank you for joining in. Bye, everybody.
$4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around.